Welcome to He Info channel. Did you know that anxiety disorders are very common, affecting nearly 30% of adults at some point in their lives? In the United States, anxiety disorders are the most common mental health concern. Over 40 million adults in the U.S., 19.1%, have an anxiety disorder. The antidepressants most widely prescribed for anxiety are SSRIs such as Prozac, Zoloft, Paxil, Lexapro, and Celexa. In this video, let's go deeper into one of them, Prozac. What is Prozac? Prozac, fluoxetine, is an antidepressant that was first introduced in the United States to treat depression and panic disorder in the 1980s. It is part of a class of medications known as selective serotonin uptake inhibitors, SSRIs. Prozac comes in the following forms, which are all available as generics. Tablets, 10 mg, 20 mg, 60 mg. Capsules, 10 mg, 20 mg, 40 mg. Liquid solution, 20 mg, 5 ml. Delayed release, DR, capsules, 90 mg. This video discusses how Prozac works and what you should know before taking it. It also covers potential side effects, interactions, withdrawal symptoms, and other medications you might consider. How it works. Much like a skilled craftsman understands the tools of their trade, let's explore how this medicine interacts with the body. As an SSRI, Prozac works by preventing the brain from reabsorbing naturally occurring serotonin. Serotonin is involved in mood regulation. In this way, Prozac helps the brain to maintain enough serotonin so that you have a feeling of well-being, resulting from improved communication between brain cells. Research also highlights how medications such as Prozac may help in combination with psychotherapy. In a 2008 study in mice published in Science, Prozac helped the brain to enter a more immature and plastic state, possibly making it easier for therapy to have an effect. Studies like this have provided insight into why combining medications such as Prozac with talk therapy can be effective for anxiety. Uses and indications. Now that we've laid the groundwork, let's explore the practical landscape of this medication's use. While Prozac is primarily known as an antidepressant medication, used to treat major depressive disorder, MDD, it's approved by the U.S. Food and Drug Administration, FDA, for treatment of various anxiety disorders, including panic disorder, the involvement of recurrent panic attacks, which are sudden episodes of intense fear, with physical symptoms of rapid heartbeat, trembling, and sweating. Prozac can help reduce the frequency and severity of panic attacks. Obsessive-Compulsive disorder, OCD. Prozac can help reduce symptoms of intrusive thoughts and compulsive behaviors from OCD. Prozac is considered an effective anxiety medication and is often recommended as a first-line treatment strategy from prescribers. For people diagnosed with an anxiety disorder, Prozac helps rewire the brain to respond more appropriately to stress or other triggers. Doctors sometimes prescribe Prozac off-label. An off-label prescription is when a medication is used to treat a condition that it wasn't originally intended to treat. But if your doctor believes it can be an effective treatment strategy for another condition, they may prescribe it. Off-label uses of Prozac include binge eating disorder, body dysmorphic disorder, dysthymia, generalized anxiety disorder, GAD, post-traumatic stress disorder, PTSD, premenstrual dysthymic disorder, PMDD, social anxiety disorder. Prozac can be a safe and effective part of your treatment plan, both for short and long-term use, when taken as directed by your doctor. Dosage and administration. Prozac is usually prescribed at a low dose to start, and then gradually increased to 20 mg per day. The maximum dose is 80 mg a day. Can be taken as a liquid or capsule and should be used as prescribed. It can take several weeks for effects to show, so it is important not to stop taking Prozac abruptly even if you think it is not working. Take the medication only as prescribed by a doctor or psychiatrist. Stopping suddenly could be dangerous and cause withdrawal symptoms. Side effects and precautions. Moving forward, let's discuss the potential side effects and how to minimize risks. The following side effects may get better over time as your body gets used to the medication. Common side effects: difficulty falling asleep, up to 33%. Nausea, up to 29%. Headache, 21%. Weakness, up to 21%. Diarrhea, up to 18%. Low appetite, up to 17%. Drowsiness, up to 17%. Anxiety, up to 15%. Nervousness, up to 14%. Tremor, up to 13%. Dry mouth, up to 12%. Throat pain, up to 11%. Yawning, up to 11%. Low sex drive, up to 11%. Rare side effects include bleeding or bruising, extreme anxiety, feeling confused, fever, vomiting, seizures, rash, hives, suicidal thoughts or behavior, swelling, trouble breathing or swallowing. If you experience any of these severe side effects while taking Prozac, contact a healthcare provider right away. Prozac should not be combined with monoamine oxidase inhibitors, MAOIs, or taken within 14 days of discontinuing an MAOI. You should also allow at least 5 weeks after stopping Prozac before starting an MAOI. The antipsychotics pimozide and thioridazine also increase the risk involved in taking Prozac. Prozac should not be taken at the same time as tricyclic antidepressants, TCAs, or drugs metabolized by CYP-D6. Care should also be taken if using drugs that affect the central nervous system, CNS, such as benzodiazepines. Prozac should not be combined with alcohol, certain over-the-counter, e.g., aspirin, due to the risk of bleeding, and prescription medications, and nutritional supplements or herbs, for example, St. John's wort. Be sure to tell your prescribing physician about everything that you are taking. In short, taking Prozac with other medications or supplements can lead to drug interactions. Always tell your doctor about any other medications you are taking before you begin taking Prozac for anxiety. Conclusion. In conclusion, fluoxetine, Prozac, is a selective serotonin uptake inhibitor, SSRI. It's used to treat several mental health conditions, including depression and panic disorder. The immediate-release pill and liquid are taken by mouth, typically once or twice daily. The delayed-release capsule is taken weekly, but it's approved only for depression. Some common side effects of fluoxetine, Prozac, include headaches, difficulty sleeping, and tiredness. Don't suddenly stop this medication if you've been taking it for a while. Doing so can lead to symptoms of withdrawal. Here are some frequently asked questions about Prozac, fluoxetine. What does fluoxetine, Prozac, feel like when it starts working? How you feel after starting fluoxetine, Prozac, can differ depending on your medical condition and how serious your symptoms are. For example, some people who took fluoxetine, Prozac, for depression noticed feeling more energetic or having a more positive mood after a few weeks of taking fluoxetine, Prozac. But it can take 1-2 months to experience the full benefits of this medication. At the same time, you might also notice some side effects from this medication. Some of the more common ones include difficulty sleeping, headache, and nausea. Talk with your psychiatrist if you've more questions about what it might be like to take fluoxetine, Prozac. Does fluoxetine, Prozac, help with anxiety? Fluoxetine, Prozac, isn't FDA approved for generalized anxiety disorder, GAD, but it's one of the first choice options for GAD, off-label use. Talk with your psychiatrist if you've more questions about fluoxetine, Prozac, and anxiety. How long does it take for fluoxetine, Prozac, to work? It will take a few weeks before you notice any benefits from fluoxetine, Prozac, but it can take about 1 to 2 months before you feel the full benefits of this medication. But the exact length of time can differ depending on what medical condition you're being treated for. Keep in mind that when you first start fluoxetine, Prozac, your psychiatrist will likely prescribe a lower dose to help your body get used to this medication and watch for any side effects. Typically, if you don't notice any improvements with fluoxetine, Prozac. After taking it for about a month, your psychiatrist might raise your dose. Contact your psychiatrist if you're not sure if fluoxetine, Prozac, is working. How much is Prozac without insurance? Prozac, fluoxetine, is an FDA-approved medication used to treat depression and other mental health conditions. Without insurance, brand name Prozac costs an average of about $634.38 for a month's supply of 20 mg capsules. What you pay will depend on your location, pharmacy, dosage, and other factors. Thank you for watching. We hope this video about Prozac has been helpful and answered your questions about depression and anxiety treatments. If you enjoyed this content, please give it a share it with someone who might benefit, and don't forget to subscribe to HeInfo for more clear and reliable medication guides. Coming up next, Zoloft Medicine Explained. Stay tuned for another deep dive into how it works, its uses, and key precautions. Got more questions or suggestions? Drop them in the comments below, and we'll feature them in our future Q&A. Stay healthy, stay informed, and see you in the next video.